Mr. Hopkins. My name is Pamela Pedron, and I'm a nurse leader in the Denton County area, and I appreciate you taking time to meet with me today.
It's nice to meet you, Pamela. Let's have a seat.
Thank you. The purpose of this meeting is to present to you my agenda for advancing organ donation and increasing organ donation rates in Texas. My research demonstrates you were present and testified at the 82nd legislative session in support of House Bill 2904, transferring the Glenda Jackson Donate Life Texas from the Department of State and Health Services to a nonprofit organization of which you're a representative for Southwest Transplant Alliance. And since the bill was enacted in January of 2012, the nonprofit organization has advanced the registry from the bottom of the nation's list into the top 15. As you, I am very passionate about organ donation, and I believe my next step agenda would assist to increase the registry to one of the highest in the nation.
Go on, you have my attention.
Thank you. Research suggests exposure to education concerning organ donation encourages family discussion and provides accurate data so informed decisions can be made by individuals. And the more informed the individual, the more willing they are to donate. Therefore, I believe the key to increasing the donation rate in Texas is through healthcare provider education. And the healthcare provider most well positioned to advance public education is the nurse. Currently, House Bill 2904 states the nonprofit organization will encourage medical and nursing schools to include mandatory organ donation education in the curricula. I believe we need to advocate for mandating education within the nursing school areas. I also believe we need to advocate for the Texas Board of Nursing to mandate a regulatory education requirement of organ donation for all nurses when applying for Texas licensure. And finally, we need to advocate mandatory education or mandatory education materials be provided to all patients and families entering acute care facilities at the time of advance directive discussion. I'm aware that 117,000 individuals are waiting for organ donations, and 13,000 of those reside in the state of Texas, with 60% of them being under the age of 64. Therefore, I believe nurses must be advocates and educators for organ donation if we are going to close the gap between organ donors and those requiring this gift of life.
How can you assist the organization with this agenda?
Well, I believe being actively involved within the nursing community, I would like to partner with members of your team to examine strategies for advancing this agenda.
Okay, let me put you in touch with our Director of Public Relations.
Thank you so very much for your time, and I look forward to working with your team for advancing this worthy cause of organ donation.
Thank you.